Okay, so hello ma'am. So I hope your family is staying well amidst this situation. So now for our reporting. So now we're going to discuss about the poisoning on health problems about toddlers. So first is what we should know about toddlers is that their gross motor developmental skills is that they tend to more climb, tend to stand up to climb the kitchen or suck up anything that they would find. So because of that gross motor skills that they have, they tend to sucking. They are more susceptible to poisoning. So they get poisoned from food or from their toys, the chemical components of their toys. But more specifically, commonly is the lead poisoning. So lead poisoning is from any lead container or any things that have lead component which a toddler could ingest. So by that, like for example, if in the kitchen there are like ceramic plates or ceramic stove or anything that the child would ingest or like get particles from it, they would get from any kind of lead poisoning, and that's why child proofing is one of the most effective way to do it. But however, my group mates will discuss about critical manifestations like the procedure management and anything that we should know about the lead poisoning.
Hi ma'am, good morning. My name is Berkeley. So, my part of the report is the etiology of poisoning, or most commonly lead poisoning in children. The most common contamination include inhalation, ingestion, prenatal exposure, and dermal exposure. But the most common is inhalation and ingestion. Ingestion is more common in children, while inhalation is more common in occupationally exposed adults. Deteriorating lead paint in pre-1979 housing remains the most common source of lead exposure in children, accounting for up to 70% elevated levels. Other common sources of lead exposure include batteries, putty, cement, important canned foods, cosmetics, jewelry, leaded glass artwork, farm equipment, and illicit intravenous drugs.
Hi guys, my name is Jeremiah Jimo, and for our topic poisoning, my part is the clinical manifestations or the symptoms experienced by children with poisoning. So the first and most common symptom is the abdominal pain or cramping. This is caused by the irritation of the GI tract by the chemical or its corrosive effects. The second is sores or redness of the mouth or the lips. Another is diarrhea. Another can be rashes. Children also experience fainting and seizures and sometimes uncontrolled shaking. Another symptom of poisoning is fever, rashes, just as we've said earlier, and also shortness of breath and lethargy.
So, for the diagnostic findings of poisoning, first we go to lead poisoning. There is no safe level of lead accumulation in a child's body. Lead poisoning is said to be present when the child has two successive blood serum lead levels greater than 5 micrograms of lead per deciliter of whole blood. Ingestion of lead and chronically elevated lead levels can be identified through radiology of the intestinal tract and long bones. So next, iron poisoning. It is difficult to estimate the amount of iron a child has swallowed because the amount of elemental iron in compounds varies and parents can only guess at the number of pills that were in the bottle before the ingestion. Obtaining blood for a serum iron level analysis should be performed to establish a baseline. Third, food poisoning. Food poisoning is often diagnosed based on a detailed history, blood test, stool culture, or examination for parasites to identify the cause and confirm the diagnosis. So last, the drug poisoning or drug overdose. The manifestations of drug overdose can be complex and result in a variety of physiological effects. Drug overdose situations involving multiple agents further confuse the clinical picture. In these cases, the best treatment may involve observation alone. This review describes the current diagnostic and management techniques for the drug overdose patient. Specific drug groups that are commonly used for overdose are discussed with an emphasis on physiological manifestations of intoxication and poisoning and the potential of delayed effects.
So for the nursing management, the most common for a toddler is to have lead poisoning. So first is we need to assess for the history and physical examination. For the history, we need to assess for the presence of lead in any household, furniture, or any lead-containing materials. Second is physical examination. Assess the child for signs of lead poisoning, such as hyperactivity, lethargy, irritability, pallor, and signs of shock. And nursing diagnosis. The major nursing diagnoses are delayed growth and development related to effects of lead on the brain, disorganized infant behavior related to irritability and lethargy, and ineffective breathing pattern related to shortness of breath. And for nursing care planning and goals, the major goals are the child will have a normal blood lead level, the child will be able to communicate and interact with the parents, breathing pattern will return to normal. For the nursing intervention, it includes reduced lead exposure, and medication administration. We need to administer irritate calcium disodium as ordered intravenously because intramuscular administration is painful. We need to also to monitor the side effects. All the chelating drugs may have toxic side effects. And children being treated must be carefully monitored with frequent urinalysis, CBC, and renal function tests. We also need to educate the family about lead poisoning, prevention, and nutrition. And remove lead-containing materials. Throw out painted toys if you do not know whether the paints contains lead. You need to avoid canned goods from foreign countries. And the walls must be covered with a paneling or a masonite. So for our nursing evaluation, the goals are met as evidenced by the child will have a normal blood lead level, the child will be able to communicate and interact with the parents, and the breathing pattern will return to normal.
So for our nursing responsibilities, first is to reduce lead exposure. Pediatric clients should only be admitted to pediatric centers with intensive care units. They should be a team that includes toxicology, neurology, and neurosurgery. Second is to monitor the child's neurologic status and fluid balance. Third is to administer medication via intravenous because intramuscular administration is painful. Fourth is to monitor all side effects because all chelating drugs have toxic side effects and children being treated must be monitored with frequent urinalysis, blood cell counts, and renal function tests. And last but not the least is to educate the client as well as their family on how to prevent the lead poisoning of their children. So they need to learn the prevention and nutrition because nutrition reduces the chances of having lead poisoning, and prevention is we have to eliminate poisonous substances within the child's reach and to teach the child to always wash their hands, not to play with dirt, and not to eat paint chips.
Parental education about the risk of lead poisoning is crucial. Teach parents how to eliminate sources of lead from the child's environment. Teach them to keep toddlers away from window sills and other common sources of lead paint. Placing the television or an overstuffed chair against the windowsill may be ineffective as a temporary measure. As a rule, children's cribs should be placed about 3 feet away from walls in older homes to reduce the risk of children picking a loose wallpaper when they first wake in the morning or before they sleep at night. Because the plaster, which contains the lead, clings to the wallpaper. All children with elevated lead levels need careful follow-up care to determine the seriousness of their condition and to ensure that they are kept from a lead source. Because children who recover from symptomatic lead poisoning have a high incidence of permanent neurologic damage. All children with elevated blood levels need appropriate follow-up care to evaluate development and intelligence. To reduce blood levels, or we can say to remove lead from the circulating blood, chelation therapy can be administered as ordered. Chelation therapy uses special drugs that bind to metals in the blood. Chelating medicine can be through an IV tube in the arm. It's also available in pill form. Once the drug has attached in the metal, the body removes them both through pee. Provide parents with these prevention tips. Allow tap water to run for 2 minutes before using it for drinking, cooking, or mixing formula. Don't store food in an open can, nor use cookware or ceramic dishes that may contain lead. Teach the child to carefully wash his hands with hot, soapy water before eating.